Hi guys, welcome to my channel. IJ here. We have a special guest in our channel
Betty,
today.
hi, hey guys, I'm so happy to be here. My name is Betty of Betty's Homestead.
Welcome, welcome, welcome. We'll be
Thank
discussing
you.
something very important today, and I'm sure you've seen from the topic already, the
Yeah,
title, what we'll be talking about. We'll be talking about CS, cesarean
and
section, and
vaginal
vaginal.
delivery.
Thank you. So, what do you think those two mean?
Yeah, they are all childbirth related terms.
Mm.
So the CS, which is cesarean operation, that's the full name,
Mm.
is when a child is given birth to not through the vagina but through a surgical cut on the mother's tummy,
Yeah.
just to bring out the child, either because of an emergency or because of a choice of the parents. And then vaginal delivery is what some people call the natural delivery, which I don't
Please,
like.
please.
But that's
Does
the
it make
process.
cesarean section or
Unnatural,
natural?
unnatural. But that's the same birth process where the child comes out
Through the
through the
birth
woman's
canal.
birth canal. Yeah.
Yeah, yeah. Thank you for that. So, what are the pros and cons of this delivery?
Delivery. Well, there are lots of pros, but since I'm not a medical person,
Mm.
I'm just going to say it from my own
Experience.
perspective and experience.
Okay. If I will ask, which one have you experienced?
I've experienced the cesarean form of delivery.
Same here too. Well,
Yeah.
I almost experienced the vaginal birth because I
Okay.
was in labor for hours,
Oh,
and then I
wow.
had to have an emergency CS for
Yes.
my first baby. Yes. Mm.
Okay. Mine was not an emergency. It was
Mm.
a planned cesarean operation,
Okay.
but with go ahead from my doctor
Okay.
because of the nature of my pregnancy. So I had multiple births, twin delivery,
Nice.
and close to the end of my pregnancy, we discovered that like the kids were getting too big and too movements were getting slower
Mm.
by the day. Okay, so prior to when I made my concerns known to the doctor, he was very optimistic that we'll go through the vaginal birth. But as at 36 weeks, from 35 to 36 weeks, that's when we started noticing the slower fetal movements of the babies and all. So it was just, I was just helped to get onto 37 weeks
Okay.
because he said that would be the safest
Yes.
time
I
to
learned that
start
that's the best time to do it for
to do.
boys
Exactly,
because by that
exactly.
time their penis would have fully formed.
Yeah. So I had to like push until 37 weeks. So we picked a date in my 37th week of the pregnancy and then had it done. So I didn't experience the labor part and all of
Okay.
that. We just picked a date, I dressed up and we went to have it done. So we've had her own version of it. She was going through the vaginal delivery, but at the end of the day, at some point,
Yeah.
it became an emergency. So an emergency operation had to be carried out. Mine was also based on doctor's recommendation, but it was planned.
Which brings me to something because you could have in mind that you're going to push your baby,
Yeah.
but all through the pregnancy, everything was fine,
Fine.
heartbeats, everything.
You
But
know,
last minute, anything can come up.
anything
So
can
you need to
happen.
be prepared and open-minded to say, okay, what are my
My
choices?
choices.
If I plan this, what if things go south, of which no one hopes for it to
For
be like
it,
that.
yeah.
But if anything comes up and there's an emergency, am I ready and prepared to take
To
this other
take the other
option?
alternative.
Yeah. So, what are your takes? What do you say? Do you have any preferred
Option.
option,
I
or
wouldn't
what
say
do you say would help someone to make a decision what they want? Because a lot of people are scared. First time moms are
moms, you
scared. They'll be like,
know,
they don't want to do. They've had so much stories and they watch so much
about
videos about childbirth, and it's so painful. They feel like CS is much
will be the
easier.
easier option.
Is it really easier?
I do not think CS is the easier option.
Okay.
While it's faster because from what the research we've made, right, it takes a longer time for the labor phase down to the delivery.
Yes.
So if you're going through
Because labors can
vaginal
actually,
birth
apart from hours,
for
can take
hours
days for
or
some
days,
women.
yes, from
So
what I've
imagine
heard.
being in
So
pain
being
for
in pain
days.
for days, like it can be really scary. But then I feel that most times after those hours or those days, that's where it ends.
Yes.
Except if you have a tear, that's where your pain ends. But for the cesarean birth,
Section, yeah.
it's just a couple of minutes, right, to an hour. But then your pain actually starts after that
Yes. Because
cesarean
during the
operation.
operation, you do not feel any pain.
Yeah,
You've
you're
been
giving
given
the
some,
anesthesia.
yeah.
Is it
So
anesthesia?
yes, so it helps
Injection and all
you.
of
You're
that.
just numb. You can only feel some pulling and
And
tugging,
tugging,
but
you
no
know,
pain. But the
initially I
pain
used
is
to think,
waiting.
I used to think that if they give you that anesthesia,
Yeah.
that you won't even feel anything. Like you just lie down there
No,
and you
you
not
definitely
even
see
know.
them
But
doing
like
like
I
this.
felt, you know how I felt quack 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 like you definitely know that like they are
uterus.
tearing you.
Yeah.
You feel the pull of the baby, but
More
it's just
than
not
5 layers.
painful. It's just not painful, but
Yes.
then the pain that comes after.
So the only thing
Oh
you
my
meet with your
God.
baby faster, quick.
Faster. But then the recovery process is not easy. I know is different from different people. Like
Yeah.
people heal, some people
Faster,
heal
somebody
faster, some people, and then some people have like stronger threshold for pain.
pain, yes.
But your pain actually starts
After
after the
delivery.
delivery. So no one is easy.
True.
But then you have to spend days. Are you talking about the days you're going to spend in the hospital?
4
I
to 5
spent like
days.
5 days
Yeah.
in the hospital. You have to learn how to walk again. You have to learn how
Even
to
your bowel
sit,
movements,
bowel movements,
because it has
and
been
all.
moved, yeah,
No,
so
it's not the easy way. It's definitely not the easy way. I think the both of them, they are
they're
both good. It just depends on
your doctor
what your
says.
doctor says.
Yeah. Because I know some people are so scared to have kids and they don't even want to consider vaginal birth. It shouldn't be so in my own case, in my own my opinion. You should always go with what your doctor says and what is best for you at that moment. But if it is you plan to push and at the end of the day it says you need to do
You
a
need to do an
surgery,
emergency.
then
Please
please do
just
it.
have an open mind,
Yes.
so that it will be easy for you to go with the flow during
Yes.
the delivery process, because crazy things can just happen. What you plan this minute, the next minute, it can just be a totally different story at the end of the day. And I
Yes.
think another reason why some people would not want to consider CS is because of the stigma attached to it.
Yes, the
Because
stigma is
okay,
crazy.
starting from the word natural delivery, like some people just say, "Oh, how you take born na CS have been a natural." Like it takes away something from the woman who is not going
Yes.
to say, no, be natural. They are both good forms of delivery, okay? Because at the end of the day,
As long as mother and
mother
child
is
are
safe,
safe,
child
yes.
is safe.
That's a safe delivery.
That's the best delivery option for you.
Yes.
So it doesn't matter if it is CS or if it is vaginal.
As long as both of them are safe, that's the most important thing. And we should stop shaming people. People
Exactly.
just come and feel like you're less of a woman if you don't push. I remember being at the check last when I was like 5 centimeter. By the time the doctor that will give me the injection will come, I'm sure I would have been like 7 to 8. The nurse was whispering to me that if you just enjoy a little while, that you push this baby. And she already has 4 kids. Some people it comes naturally for them.
For them.
They know when they will soon be in labor. They are in the hospital less than an hour. They literally even use their hands to pull out their baby. Some people are they are fortunate like
some
that.
Some people give birth on the way.
On the
Before they
way.
even get to the hospital, the
It's
kid
like
don't
just
come out.
peeing, like pew, and the baby's out. Out of having really,
Oh
really
my
tough.
God, yeah.
So she was like, just wait a little. You just don't do this surgery. Just like get behind me.
Not be small. Okay.
I already had an open mind that I was
Yeah.
going to, if it doesn't work like this. So as soon as they said the fetal rate was low,
Was getting
that
low.
if it doesn't get better in 30 minutes time, they will suggest us doing a CS. I said, no need to wait for 30 minutes time. Just bring the form. Let's sign already.
That's it now.
Let's sign already. And what happened when the baby came out? The cord was around my son's neck. So
the
imagine if I said I must push
Wait
this
and
baby.
push.
It can just go really bad, because sometimes a few doctors will be able to see it and say,
then try
hold
to-
on,
yeah,
and
try
don't
to
push. Let's remove this
remove
cord
the
around.
cord.
But what if I was not listening? I'm like one of those moms, like, please, I want to
I
get the
know, I
baby
can't
out.
wait. I can't
just
hold it.
push it, God forbid, and then it strangles the child after a whole 9 month plus.
Of
It won't make
carrying
sense.
the
So
pregnancy
it's always
and
good
all
to
of that.
listen to professional advice and see what is best for you at that moment and follow through. don't look at the money. Or sometimes
Exactly.
the economic problem,
Because
the
we all know
financials,
that, of course, the CS is quite more expensive
Yes.
than the vaginal delivery. So sometimes, because of the economic situation we find ourselves, we tend to want the cheaper option.
Yes.
If the cheaper option is not the favorable option,
If it's not the
please,
safest
if it's not the
one.
safest option for you,
Yeah.
because at the end of the day, if something happens to that child, you still have to pay money.
You still pay
There
bills
are
at the
cases
hospital.
where emergency operations are carried out on moms to remove a dead child.
Yes.
To remove a dead child.
So
So at
like,
the end
why
of the
did I
day,
do
you
the
still
CS in
did
the
the
first place?
CS, and then now you lost a child in the process. So please, if that is not the safest option for you, just go with the safest option.
Yes.
You better say you and your pikin in the hospital now go hustle money, come pay doctor, than the
Once
story
there's life,
becomes,
you are even happy.
there's
Even when
hope.
you don't have food in your tummy, you're seeing your child, you're okay.
They're okay.
Money will definitely come. Your family, friends can support you. You pay the debt,
You
and
pay
you're
the
alive
debt.
to pay it, than for you to lose your child or you lose a wife in the
In the
process
process.
and still pay
In the
and while
process.
crying. Is really, really sad. A lot of women do this. Recently, I had a story of someone who sews close to my sister's home, and then she had a baby. She had the first child. The child is about 5 year old, and then this second one, it was time for her to give birth. She went to a maternity home, and then she gave birth to this baby. They said she could push. It was an emergency. Why don't you refer her
To the
quickly to a
hospital.
hospital? It was last minute. At the end of the day, they still had to do surgery to bring out this baby, a big baby. I don't know the full
Oh,
details, but I'm sure the pelvic must have been small, and
yeah,
the child has gone through a lot of
probably
distress.
stress.
So she lost fine, beautiful child, boy. Lost that child, and she too, she lost her life,
Oh my,
leaving behind her husband
double tragedy, and a
and
child.
a child. So it can be really, really sad. It's giving pregnancy till delivery is like life and death, a very
Death
thin
phase,
line.
like,
So you as humans, just try to be careful, do your best, and follow good advice. What
yeah,
your doctor says. Yeah. So if you are healthy, baby is healthy, everything is going smooth, and your doctor gives pass that you can go through the vaginal way, then fine,
then
good for you,
fine.
do it. But if there's a complication, something is up, and you're not sure yet, and they say CS would be a better option, please
Please.
consider taking that option too. We just want you to be fine and your baby
And
to
your
be
baby should be
fine.
fine as well. So in this aspect of which is best, is what is best for you, your child, at that point in time. So what did your doctor tell you? That's your best option.
Yes.
If your doctor say vaginal delivery, that's your best option. If he or she is recommending CS, then that's your best option.
So still on the stigma, it's really so bad that some people do not like to say
They gave birth through CS, right?
yes.
I had a first-hand experience with that. I remembered when I was advised to consider the CS option. So I mentioned it to a friend, and she now said, yeah, I gave birth through CS. And I know her. She's my very good friend, like very, very good friend. I did not know she gave birth through CS. I had no idea, down to when I was now considering that as an option. So when I mentioned it, she was like, yeah, I gave birth through CS. I said, I didn't know. She said, no, I don't like talking about it. So this same stigma, because of how other people perceive CS, some people are now ashamed to like talk about their birth story just because they don't know how another person will feel about it. So I think we as women, we have to really do better when it comes to judging
Yes.
the mode with which our fellow woman
Sometimes they
gave
feel like
birth,
you're
or
lazy. You
something.
want to do
Yeah, as if it's
CS.
the lazy
You're lazy,
man's
it's the easy
way
way route. Why do you want to do
of
that?
giving birth. So there's no need. I think if we all have, each birth experience is unique. We should take pride in the fact that we went into the delivery room and came out safely, and our child too came out safely. So if we take pride in that our birth story, I think it reduces this stigma and makes other moms too come out to like talk about their story.
If it was just men trying to shame you, you would have like, you don't know what you're saying. You never carried a baby before.
But it's different
your
when a
fellow
woman.
woman
It's different when a fellow
comes
woman
to
is
talk
coming
down on
to
you.
talk down on you just because you gave birth through CS.
I'm like, well,
So it
I'm
makes a
alive
lot
to
of
carry my baby.
exactly.
So how about that? Be open as the way you go for your antenatals. Tell your doctor how you're feeling, ask questions, and this will help you make an informed decision.
Informed decision. take note of your body too, because sometimes we as the moms who are carrying this pregnancy, if you are in tune with your body, once you notice one or two issues that could be like a problem, just be quick to mention it to your medical doctor, because like I said, in my case, it was vaginal births were considering all through. I didn't have any major issues with during the course of the pregnancy, except the usual mornings, throwing up and all of that. But no serious medical issue until I started noticing that, oh, okay, these babies, they're not really moving as at so and so time. Usually when I eat, I feel some kind of movement, or when I wake up in the morning, all those signs, you need to be very, you need to be in tune with your body, so that once you notice, because that thing you notice might change the course of your delivery story altogether. So if you're in tune with your body like that, mention it to your doctor, and then
see the way I'm feeling. I remember one time I my baby didn't move. So for hours, from the night till the next day, I was like, okay, the next morning I'm going to go first into the hospital. We're just in front of the hospital again. I'm like, what she just posing and just doing like this all day, sleeping, taking a nap. You know, so when the doctor said, okay, so you wanted to see me, I'm like, the reason I wanted to see you, she has moved. And then they still checked the heartbeat and everything. So yeah, it's always good. If anything feels off, just say it. Communicate it with your doctor, and don't delay. The doctor
tells you, oh, okay, don't worry, that's a normal fear to have, than for you to have something in mind and you didn't mention it, and then it turns out to be like a serious medical issue that should have been attended to in the first place. So like we said, at the end of the day, safety of the mom and safety of the child is what's paramount.
If you're pregnant now, we wish you safe delivery at the end of the road. If you're hoping to get one, we also pray
that it happens for you sooner rather than later.
So thank you so much for staying to the end of this video. We have a video on
coming
our channel
up on my channel as well.
Please try and
check out my channel. It will be linked, I guess, in the description of this
video. And the name of the channel again is
Betty's Homestead. So I would like to have you guys over.
Yes, please.
And if you're coming in from my channel, please like and subscribe to this video.
Yes, please.
You're going to get more and more amazing contents coming your way.